There's a virus circulating across the United States right now that most people have never seriously considered a threat. It doesn't make the evening news very often. Your doctor probably hasn't brought it up at your last checkup, and yet it's quietly hospitalizing people, particularly adults over 60, with very little warning. That virus is Hantavirus. In the next few minutes, I'm going to walk you through exactly what it is, how it enters your body, what it does once it's there, and the 5 specific steps every adult over 60 should take this week to stay protected. I've spent years studying how infectious diseases interact with the aging immune system, and what I'm sharing with you today is grounded in published medical research and real documented cases. According to the Centers for Disease Control and Prevention, the most severe form of this illness, known as Hantavirus pulmonary syndrome, carries a fatality rate of somewhere between 38 and 50%. That's nearly 1 in 2 people who develop the serious lung complication. And the older you are, the harder your body works just to survive it. Hantavirus is a single-stranded RNA virus. That means it carries its genetic code in a compact, highly efficient form that it uses to take over your own cells and replicate inside them. It belongs to the Bunявiridae family and has existed in rodent populations for thousands of years. The deer mouse is its primary host in North America. The mouse itself rarely gets sick. It simply carries the virus in its saliva, urine, and droppings, shedding it continuously into the surrounding environment with no visible signs whatsoever. In North America, the most dangerous strain is called sin nombre virus, which actually translates from Spanish as the virus with no name. It was first identified in 1993 during a cluster of unexplained deaths in the Four Corners region of the American Southwest. Healthy young people were dying of respiratory failure that physicians couldn't immediately explain. That outbreak changed how infectious disease specialists think about rodent-borne illness in this country. In South America, a strain called Andes virus has caused outbreaks in Argentina, Chile, and Brazil. It holds a uniquely alarming distinction. It's the only known hantavirus strain with documented human-to-human transmission. In Asia and Europe, related strains cause hemorrhagic fever with kidney involvement rather than lung disease. Different strains, same underlying pattern. They all exploit weaknesses in immune function that become more common as we age. Now let's talk about how this virus actually gets into your body, because this is the part that surprises most people. The primary route of infection is inhalation. You breathe it in. When infected rodents contaminate an enclosed space, a garage, a basement, an attic, a storage shed, a cabin that's been shut up since last fall, their dried waste breaks down into microscopic particles that attach to dust and become airborne. The moment you walk into that space and disturb those particles by sweeping, moving boxes, or even just walking through, you're potentially breathing them in. They travel down into your lungs, reach the deepest tissue, and the infection begins. Research published in the journal Emerging Infectious Diseases has shown that the virus can remain infectious in the environment for several days and in cool, dry, sheltered conditions, potentially longer than that. Here's something critically important for anyone over 60. After about age 65, the mucociliary clearance system, the network of tiny hair-like structures lining your airways that trap and remove foreign particles before they reach your lungs, loses roughly 30 to 40% of its efficiency, according to research from Johns Hopkins University School of Medicine. That system is your body's first line of defense against inhaled pathogens. In a younger person, it may partially clear viral particles before they reach the deep lung tissue. In someone in their late 60s or older, those same particles are far more likely to reach the alveoli, the tiny air sacs where gas exchange happens and where hantavirus causes its most serious damage. So what actually happens once the virus is inside you? The incubation period, the time between exposure and the appearance of symptoms, ranges from 1 to 8 weeks, with most people becoming symptomatic between 2 and 4 weeks after contact. That long, silent window is one of the most dangerous features of this disease. You can feel completely fine for weeks while the virus is quietly replicating inside you. The illness typically begins with what physicians call the prodromal phase. For the first 3 to 5 days, you feel like you have the flu. fever, fatigue, muscle aches, especially in the thighs, hips, and lower back, headache, dizziness, sometimes nausea. Most people, and honestly many physicians who aren't specifically watching for it, would assume influenza or a common viral illness at this stage. Meanwhile, the virus is replicating inside the cells lining your blood vessels. Then, within 4 to 10 days of those initial symptoms, the disease can shift into what's called the cardiopulmonary phase. This is the phase that sends people to the emergency room. As the blood vessels in the lungs become increasingly damaged, fluid begins flooding the air sacs. Breathing becomes rapidly and severely compromised. Not a mild shortness of breath, but a desperate, frightening inability to get air. Oxygen levels in the blood fall. Blood pressure drops. The heart, now struggling to function without adequate oxygen, begins to falter. This progression from the first sign of breathing difficulty to complete respiratory failure can happen in as little as 24 to 48 hours. Many patients require mechanical ventilation and ICU admission within a single day of respiratory symptoms appearing. There is currently no approved antiviral medication for hantavirus. Treatment is entirely supportive: oxygen, ventilation, fluid management, and intensive monitoring. Prevention is not just important. It is everything. Let me share a few real documented cases, because this isn't a theoretical conversation. In the summer of 2012, a cluster of hantavirus infections was linked to tent cabins at Yosemite National Park in California. 10 people were confirmed infected. 3 of them died. The CDC investigation found evidence of rodent activity in the insulation of the cabin walls. Thousands of prior guests had to be contacted and monitored. The outbreak required a complete redesign of the structures involved. In 2020, a man in his early 60s in Washington state spent a weekend cleaning out a long unused storage barn on his rural property. He wore no respiratory protection. He'd done similar work many times before without incident. Within 2 weeks, he developed what felt like a bad cold that progressed into pneumonia. He was hospitalized and on a ventilator within 48 hours of admission. He survived after 18 days in the ICU, but spent the following 8 months in pulmonary rehabilitation and reported that his lung capacity never fully returned to where it had been. In the Chubut province of Argentina, a 2019 Andes virus outbreak resulted in 29 confirmed cases and 11 deaths. Health authorities documented chains of transmission through households, and in one case to a healthcare worker who had treated an infected patient. The World Health Organization issued formal guidance in response. And in Colorado, a state within the historical endemic zone for sin nombre virus, the Department of Public Health confirmed 3 cases of hantavirus pulmonary syndrome in 2023. 2 of those cases involved adults over 65. 1 did not survive. Now I want to give you 5 specific things every adult over 60 should do this week, ranked in order of importance, from helpful all the way up to the single most protective action you can take. Number 5 is conducting a complete rodent inspection of every enclosed space on your property. Not next month, this week. Your garage, basement, attic, garden shed, any outbuildings, your crawl space, stored vehicles that sit unused for extended periods. You're looking for small dark droppings that resemble grains of rice, gnaw marks on wood or plastic, shredded nesting material, grease tracks along baseboards, or a musty odor in enclosed areas. Before you enter any space, open the doors and windows and let it air out for a full 30 minutes. Don't bend down and inspect closely in a sealed room without protection. Research from the University of New Mexico found that approximately 12% of deer mice trapped in rural areas of the American Southwest carry sin nombre virus. That's roughly 1 in 8 mice. And after age 70, your innate immune system, the rapid response mechanism that fights pathogens before your adaptive immune system even mobilizes, operates at roughly 40% of the efficiency it had at age 40. That reduced margin makes early detection of a rodent problem genuinely important. Number 4 is using the right protective equipment and being specific about what that means. When entering any space with signs of rodent activity, you need an N95 respirator, not a cloth mask, not a surgical mask, a certified N95 that creates a tight seal around your nose and mouth and filters at least 95% of airborne particles. Standard surgical masks allow air to flow around the edges and offer essentially no barrier against aerosolized viral particles. You also need disposable nitrile gloves. For a significant infestation, disposable coveralls or clothing you can immediately bag and wash in hot water is a reasonable precaution. I know it sounds like a lot for a routine trip to the shed, but consider this. A basic N95 and gloves cost around $15 to $20 at any hardware store. A single day in an intensive care unit costs between $3,000 and $10,000, and no amount of medical intervention fully restores the lung function that Hantavirus pulmonary syndrome can take from you. After age 75, the body loses approximately 35% of its pulmonary reserve, the extra breathing capacity that activates under physical or physiological stress. The margin is smaller than most people realize. Always pre-ventilate. Open windows and doors and allow fresh air to circulate for at least 30 minutes before you enter any potentially contaminated space. This substantially reduces the concentration of airborne particles. Number 3 is cleaning up rodent contamination correctly, and this is the one most people get wrong. Never dry sweep. Never vacuum up droppings with a standard vacuum. Never use a leaf blower or compressed air to clear a contaminated area. All of these actions launch viral particles into the air and directly into your breathing zone. The CDC recommends a specific protocol. Wet the contaminated area thoroughly with a disinfectant solution, either a commercial product or a mixture of 1.5 cups of household bleach per gallon of water, and let it soak for at least 5 minutes. Then, while wearing your N95 and gloves, use paper towels or disposable cloths to collect the dampened material and seal it immediately into a plastic bag. Place that bag inside a second bag and dispose of it in a covered trash container. Wipe down all surfaces where rodents may have traveled with the same bleach solution. Mop hard floors. Steam clean carpets if possible. According to guidelines from the New Mexico Department of Health, this wet cleaning method reduces exposure risk by an estimated 90% compared to dry sweeping. For an aging immune system, that difference is not a minor technicality. Number 2 is recognizing symptoms quickly enough to act. The window between the beginning of hantavirus symptoms and the point at which the situation becomes critical is measured in hours, not days. Here's the specific pattern to watch for. Fever above 101 degrees Fahrenheit, combined with significant muscle aching in the thighs and lower back, followed by shortness of breath that worsens progressively over hours, even if it feels mild at first, in anyone who has had any potential rodent exposure in the past 1 to 8 weeks. That combination is a reason to go to an emergency room immediately. Not urgent care, not a scheduled appointment in a few days. An emergency room today. When you get there, tell the treating physician clearly, "I may have been exposed to hantavirus. I was near rodents. Please consider testing me." Do not assume the physician will make that connection on their own. In a busy emergency department, hantavirus is rarely the first consideration. You are your own most important advocate in that moment. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure history to their physician early in the course of respiratory symptoms had significantly better outcomes than those whose history was identified later. Earlier recognition means earlier access to the level of care, including ECMO support, which stands for extracorporeal membrane oxygenation, an artificial lung bypass system that gives the best chance of survival. One more thing worth knowing. After 65, the inflammatory response that normally signals illness can be both less reactive and less predictable, a phenomenon researchers at Stanford University School of Medicine have described as inflammaging. You may genuinely feel less sick than you actually are. Don't wait for symptoms to feel severe before taking them seriously. And now, number 1. The single most protective step every adult over 60 can take this week is having a direct, proactive conversation with their primary care physician about personal hantavirus risk before cleaning season begins, before approaching rodent-prone spaces, and before any potential exposure occurs. A 2022 survey conducted by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk, meaning illnesses transmitted from animals to humans, with their primary care provider. That's a striking gap. Your physician can do things that no amount of protective equipment can replicate. They can review your individual immune status. They can assess whether any of your current medications, corticosteroids, certain antihistamines, some blood pressure drugs, may be suppressing immune function in ways that increase your vulnerability. They can note your risk profile in your medical record so that if you arrive in an emergency room with respiratory symptoms, the clinical picture comes together faster. And they can flag you for priority evaluation and potential transfer to a facility with advanced respiratory support. There's no vaccine for Hantavirus. There's no preventive antiviral you can take ahead of time. But an informed physician who knows your risk is one of the most valuable resources you have. Before your next appointment, consider writing down the key points from what you've learned today. Bring them with you and say directly, "I want to talk about hantavirus risk. I spend time in or near areas with potential rodent exposure. What should I know and what should be noted about me in case I become ill?" That conversation, for someone in their late 60s who visits a rural property in the summer, or a person in their 70s who regularly works in an outbuilding, could be genuinely consequential. You are not at the mercy of this virus. You now have specific, actionable information that the majority of people, including most of your peers, simply don't have. You know what hantavirus is, how it spreads, and how fast it can escalate. You know what real documented cases have looked like. And you know 5 concrete steps you can take this week to meaningfully reduce your risk. Do the rodent inspection. Get the N95 and gloves. Learn the wet cleaning protocol. Know which symptoms demand immediate emergency attention. And talk to your doctor. These steps aren't complicated. They aren't expensive. But they represent the difference between being prepared and being caught completely off guard. The ability to open up a cabin in spring, clean out a garage on the weekend, work in a garden shed on a Saturday afternoon. These are not small things. They're part of a full, active life, and it is absolutely possible to protect that life with the right information and the right habits. It doesn't matter if you've been doing this kind of work for decades without a second thought. Starting now, with what you know today, you can change what comes next. If you found this helpful, consider subscribing to Health Talk for more health education videos. Dr. Eliza Hart and the Health Talk team release new content specifically focused on the health topics that matter most for adults over 60.